Good day, Ma'am. I am Nika Baby Stabilio and I am going to discuss gender dysphoria. So please bear with me and please bear with the unnecessary noise. So, gender dysphoria, in simple words, is a sense of unease that a person may have because of a mismatch between their biological sex and their gender identity. So, the diagnostic criteria for gender identity disorder or gender dysphoria is that this is a strong and persistent cross gender identification, not merely a desire for any perceived cultural advantages of being the other sex. In children, the disturbance is manifested by four or more of the following: repeatedly stated desire to be or insistence that he or she is the other sex. Gender dysphoria is a concept designated in the DSM-5 as clinically significant distress or impairment related to a strong desire to be another gender, which may include desire to change primary and or secondary sex characteristics. Not all transgender or gender diverse people experience dysphoria. So, here are some symptoms of gender dysphoria. Symptoms of gender dysphoria can include feeling of strong sense of distress or discomfort with one's assigned gender. Some signs that someone is experiencing gender dysphoria or gender identity disorder include: first is a desire to no longer have the primary sex characteristics of their birth assigned gender. For example, in male, they no longer want to have their first sex characteristics, specifically the penis, and then female ovary. So another one is a desire to be treated as the opposite gender. Like for example, if you are a male, he wants to be treated as female. The next symptoms is that this person is having a desire to have the primary or secondary sex characteristics of their preferred gender identity. For example, he is a male and then he wants to have the sex characteristics of a female. Next one is the insistent that they are a gender different from their birth assigned sex. Another one is preference for cross-sex roles and strong rejection of toys, games, and other things that are typically associated with their birth assigned gender. Like for example, a boy or a children, he is a boy but he wants to play the Barbie or cooking games. Next one is wearing clothes. Wearing clothing typically associated with the opposite sex. Causes of gender dysphoria. The exact causes of gender dysphoria are not completely understood, but several different factors may have may play a role. Genetics, hormonal influences during prenatal development, and environmental factors may be involved. Uh, Prenatal or when mother is pregnant, it can affect this that may lead to gender dysphoria. For example, prenatal exposure to a certain chemicals that has been associated with disruption in the normal development of sex dissemination determination prior to birth. Research also points to a genetic link since there is a higher shared prevalence between identical twins than between fraternal twins. The onset of gender dysphoria is often during early childhood, while the exact mechanism are unclear. We do know that when children are born, they are assigned a sex based upon their physical anatomy. The sex that a child is assigned at birth often determines how they are raised and how others interact with them. As they grow older, they may begin to feel that there is a mismatch between their gender identity and their assigned sex. In some cases, this mismatch can lead to a feeling of gender dysphoria. So, mascul- masculinizing and feminizing hormones can sometimes help lessen or resolve feelings of gender dysphoria. Such hormones can have side effects including changes in libido and the potential for manic, hypomanic, and psychotic symptoms in people with underlying psychiatric condition. However, people who do not have the ability to take any of these steps may begin to experience feeling of increased psychological distress, including feelings of anxiety and depression. In such cases, psychotherapy may help people feel more comfortable experiencing their internal sense of gender and improve mental well-being. So, in boys, preference for cross-dressing or simulating female attire. In girls, insistence on wearing only stereotypical masculine clothing. For example, a girl likes to wear oversized men's shirt, jeans, shoes for men, and strong and persistent preferences for cross-sex roles in make-believe play or persistent fantasies of being the other sex and pastime. So, also have intense desire to participate in the stereotypical games of other sex. This one's the symptoms. So, let's proceed to the treatment to gender dysphoria. Treatment for gender dysphoria is highly individual and based on each person's unique needs. It usually focuses on helping the individual explore their gender identity, often by following them to express their gender in a way that corresponds to their internal sense of gender. This can include dressing in a way that aligns with their gender identity, using names and pronouns, or taking medical steps to physically change the body. In addition to counseling, treatment for gender dysphoria may involve hormones and gender reassignment surgery. Here are the medical options. Some people with gender dysphoria may prefer more extensive treatment that involve the use of cross-sex hormones and gender-affirming medical procedures. Treatment may also involve body modification that can help align a person's outward presentation with their internal gender identity. Hormone therapy and surgery are two ways that this might be accomplished. But again, treatment needs to be adapted to the needs and goals of the individual. Some people may want to achieve a full transition to the gender which they identify. Others may wish only to minimize the secondary sex characteristics such as facial hair or breasts that do not align with their gender identity. It is important to remember that while surgical gender affirmation surgery is an option, not everyone with gender dysphoria makes the choice. Surgery is expensive and usually not covered by insurance. Not everyone wants to have complete gender reassignment. Hormone therapy may help some people while others may opt to change their outward gender expression and way of dress to correspond with their internal sense of gender identity. So here's the psychotherapy for gender dysphoria. Some individuals may only wish to have counseling to help them feel more comfortable with their feelings, to affirm their identity, and to help them cope or reduce any feelings of distress. Relationship or family counseling can help partners, parents, and other family members better understand what their is loved one is experiencing. So, family counseling can help uh, families with person who is experiencing gender dysphoria can go to a family counseling so that instead of judging their family member, they will be able to support him or her. This can help the individual more social and peer support, which can provide a more affirming environment. Psychotherapeutic treatments for gender dysphoria do not try to change an individual's gender identification. Instead, psychotherapy focuses on helping people feel more comfortable in their identity and expressions of their gender. So the goal is to help people feel more fulfilled and improve their quality of life by lessening feelings of dysphoria. This is sometimes accomplished by exploring gender identity and expression, learning ways to manage stress, practicing self acceptance, building a support network, making decisions about transitions option, improving relationships. Therapy can not only help people reduce feelings of dysphoria, but it can also help people at any phase of the process to improve their quality of life and well being. So that's all. Thank you so much for listening.